Hello everyone. Today we'll be talking about Wellen syndrome. Wellen syndrome describes an abnormal ECG pattern which is characterized by deeply inverted T waves in leads V2 and V3 that are secondary to proximal left anterior descending artery stenosis. Patient often presents to emergency department pain-free and cardiac enzymes are usually normal or only slightly elevated. So this is the variant of STEMI where patient have T wave inversions is basically results from a temporary obstruction of the iliac coronary artery. So there is occlusion of the left anterior descending artery due to a thrombus, which automatically get lysed or disrupt, or there is a disruption of occlusion before complete myocardial infarction has taken place. So Wellen syndrome represents a pre-infarction state. However, due to the unstable nature of this coronary perfusion, these patients are at high risk for extensive myocardial infarction of the anterior cardiac wall and can lead to possible death. The exact mechanism of the ECG changes of Wellen syndrome is not known, but some theorize that coronary artery spasm and stunned myocardium causes it. Others postulate that it is caused by repetitive transmural ischemia reperfusion leading to myocardial edema. So you can see here, this is a classic Wellens pattern, A pattern, where you can see there is a biphasic T wave. So T wave is up and down here as well here, and there is minimal ST elevation you can see here, less than 1 millimeter. On evolution, later on it can go into deep inverted T waves, that is a Wellens pattern B. So diagnostic criteria, deeply inverted or biphasic T wave in V2 and V3. You can say deeply inverted and biphasic. ECG pattern will be present in pain-free state. Patient will have resolution of pain because the occlusion has resolved on its own, or there is a temporary resolution of that. There is isoelectric or minimally elevated ST elevation of less than 1 mm. There is no precordial Q waves. There is no Q waves. You can see here there is no Q waves. And then there is preserved precordial R wave progression. So R wave progression is generally preserved. So you can see here R wave is normally preserved. There is recent history of angina and cardiac enzymes are only normal or slightly elevated. You can see Wellens T wave evaluation, that is T wave changes can from type A to type B pattern. You can see here biphasic T wave, then more T wave inversion, the wave inversion increases, and then there is a symmetric T wave inversion, that is the type B pattern. So the coronary perfusion is generally unstable in Wellens syndrome, and the left-handed descending can reocclude at any time. So whenever there is reocclusion, the first sign which occurs is apparent normalization of the T waves, so-called the what is called as pseudo-normalization. So this is because of the closure evolution that there is T wave inversion. Suddenly the T waves become flattened or normalization of the T wave can occur. So if you have done a serial ECG and first ECG you see this pattern, and later on you suddenly see that this T inversion has gone away and there is normalization of T wave, or there is upward T waves, the normal T waves like that. If that pattern, if you see, it is a characteristic of, it's called a pseudo normalization, and that means that LAD there is a reocclusion of the coronary artery has occurred. So this is a sign of hyperacute STEMI and is usually accompanied by recurrence of chest pain, although the ECG change can precede the symptoms. If the artery remains occluded, the patient can later on now develop STEMI, classical ST elevation MI. Thank you.